So today we're going to be talking about hypertension. It simply means an abnormal rate with which the blood slams or hits the arterial walls. The normal blood pressure is less than 120 systolic by 80 millimeter mercury diastolic. Of course, it varies. What is attainable in a child is different from what is attainable in an average adult. Now, the most important thing I want to make you understand is say stage 3 hypertension, where we say your BP dey higher than 180 by 120 diastolic. Once you don't measure your BP and you dey this level like this, you must run the go hospital. No be that time you suppose dey go your babalawo place. No be that time you suppose dey go church. No be that time you go carry phone dey say pastor hello pray for me. No be that time you go call afa ejo eba mi gbadura. No, na the time wey you suppose dey go emergency clinic, emergency department of any hospital wey dey your area. Now, wetin be the causes and the risk factors of high blood pressure? Smoking, your diet. If you dey chop food wey get too much salt, try as much as possible to what? Eat food wey dey low in salt. Also, sugar no good for body. You wan ask, you say make I no chop sugar, you say make I no chop salt. Yes, if you chop sugar, e fit also lead to wetin dem dey call atherosclerosis. No worry, that one I talk for another day. Age, normally when your age don dey increase, you dey go above 40, 45, 50. That time na the time wey be say blood pressure fit dey rise. Family history, if your papa get am, your mama get am, your great grandpapa get am, there's a possibility say you sef go fit get am. Your race, scientific study don show say as black men and Afro-Caribbeans, we are susceptible. Wetin e mean say we get a higher chance of developing high blood pressure. Alcohol, stress. This Nigeria too dey stressful, especially this Lagos wey we dey. Symptoms. It is important to note that hypertension has no known symptom that is attributed to hypertension itself. That is why hypertension is called a silent killer. However, when you begin to experience headache, flushing, tingling, or noise in the ears, head spinning, like just a turn you anyhow, just a turning on you. Your belly fit just dey worry you anyhow. Stomach upset, fainting spells. Some people when they get BP, high BP, they will just dey faint because the BP too much for their body to handle. Insomnia. Wetin be insomnia? Inability to sleep, disorientation. That lead me to complication. Wetin be the big thing wey fit happen if you no manage your blood pressure? Stroke fit arise if your blood pressure particularly dey higher than 180. Some people say one blood pressure don go higher than 160, they go fit develop stroke. And wetin be stroke? Stroke simply means a shortage of blood supply to the brain. Kidney failure, heart failure, heart attack, hypertensive retinopathy. This simply means when hypertension start dey affect your eyes. So high blood pressure fit lead to blindness. It also fit lead to erectile dysfunction. No worry, that one I talk for another day. Wetin be the possible treatment of high blood pressure? The possible treatment of high blood pressure na wetin? Go hospital. No be me go come tell you the kind drug wey you go dey take so that you go pharmacy go say Dr. Ifeanyi will tell you to go buy so drug. No, go your hospital so that doctor go fit do the necessary tests wey you need to do before he go come give you drug wey you go take. Take food wey contain less salt, less sugar. E go help you well. Also, cholesterol dey in polysaturated fat or saturated fat. Now all these ones wey you dey see inside refined meat no good for body because that cholesterol now after some time as e dey flow inside your body, e go fit cause a build up in the wall of your artery wey go come lead to wetin? Atherosclerosis. Na why you wan reduce cholesterol intake as well as fat. Also, you wan do cardio. You want to do exercise because if you exercise, it will help your heart muscles. Now, exercise for your cardiovascular system. Example: swimming, running, even to the waka self, it will help your blood pressure. Lastly, we will talk about reducing stress. Nigeria is very stressful. Living currently as an adult is stressful. You want to make sure you reduce every possible physical stress, mental stress, and psychological stress. Because when you do this, your BP will drop, and that way you will get a good quality of life. As you know, health is wealth. Thank you very much for coming. Enjoy the rest of your day.